Borah works in Guwahati, Narayana Super Specialty Hospital. Over to you, sir.
I think already we are late by some time, and I have flight to catch also. So I'll be very brief and to the point. I'll try to be very brief and to the point. So permissive underfeeding is a topic. Uh, I'm going to say something about this topic. Now, is it something like IV fluid management of intravenous fluid? Because see, this is the first thing came to my mind, right? I just see the the topic, because in IV fluid, less is good and more is obviously bad. Now everybody now very concerned about health. Keto diet is very popular now. Less calorie is good. Now, is the same thing is happening in critical care patient also? So I just search the Google. Next slide, please. Google. Next slide, please. From my side. Okay. Very good. See, I just typed nutrition, and see, I got 400 crore result. Narrowing it, nutrition in critical care medicine, I got 20 crore result. Now, permissive underfeeding, I got 16,800. Now, where 400 crore and where 16,800? So, this is a emerging concept. Maybe people are talking and they are starting to talk about this underfeeding. So, next, just to say a few things very clearly, what is full feeding? Full feeding is more than 80% of non-protein calorie goal. That is full feeding. Trophic feeding is 10 to 20 ml per hour or 10 to 20 kilocalorie per hour up to a maximum of 500 kilocalorie per day. That is called trophic feeding. And permissive underfeeding is 50% to 80% of non-protein calorie goal. So this is a basic concept, that calorie restriction, ultimately the goal is to restrict the calorie. Now is it so important? Should we talk about it or should we just ignore about it? Now coming to next, excess of everything is bad. Since our childhood we have been listening to this, too much of everything is bad, excess of everything is bad. Now is it true? Let's see, nutritional support is very much important in critically ill patients. I don't have to show any evidence for this. It is established. Now, question is, what is the dose of feeding, which is important in critical ill patients? But results are very conflicting. But one thing, almost all people are saying that higher enteral, and if you are augmenting with a parenteral nutrition, that is parenteral augmentation and giving high enteral, has no benefit at all. That is almost sure. Now, is it if you restrict the calorie, is it good? Now, evidence are coming that it may actually may be good actually. So there are studies which prove that if you restrict calorie, it increases lifespan of many species, like in rhesus, monkeys, Saccharomyces. So these species, if you restrict calorie, it is proven that the lifespan increases. And it supports mammalian cell survival, improves longevity biomarkers of human, and may have good effect on metabolic, hormonal, and inflammatory pathways. So evidences are coming that restriction of calorie may be good. So few studies, they have like rice, Arabian, these all studies, I have to tell 6 studies here. Ultimately, all studies saying that if you restrict calorie, there is no difference in mortality. But if you increase it, augment it, there is definitely a problem. But restriction in calorie not going to harm. What going to harm is protein. Protein intake directly related to mortality. It is very, very well established as of now. Protein restriction is bad. It directly relates to higher mortality. So, one quote I want to give, very good line, be early for enteral, but no rush for calories. Jean Charles Bridges and Yassin M. Arabi, very good editorial. I like this line. So ultimately, as of now, the stand is regarding permissive underfeeding is be early for enteral, but no rush for calories. Protein, there should not be any restriction, even, but calorie restriction may be good. Thank you.
Thanks, Dr. Apurba. It's indeed an interesting topic because last time when we knew that obese patients do well in the ICU, there is one article on that, and these are the new findings that are coming out. I think it's something that is interesting to note. Thank you. Thank you for your talk, sir. The next talk